The duodenal switch is another type of weight loss surgery that we can offer. It typically is reserved for people who have much more weight to lose. So for example, most of the patients that I discuss duodenal switches with have BMIs of 70 or higher. In addition, if you have really bad diabetes, where potentially you're taking insulin but your blood sugars are still poorly controlled, the duodenal switch is actually an excellent procedure to consider. What it is almost a combination of a sleeve and a bypass. So in the same way that with the sleeve we make a narrow, tubularized stomach, we do the same thing with the duodenal switch. But in addition to making that sleeve stomach, we also reroute the small intestines, like we do with the gastric bypass. The difference here, though, is the amount of small intestine that is rerouted. So you heard Dr. Promomo discuss how with a gastric bypass, you still have quite a long distance of small intestine where you can still absorb nutrients and vitamins from the diet. With the duodenal switch, we reroute a significantly longer portion, so that where your food mixes with those digestive enzymes, that distance is much shorter. What that means for you is that it actually helps you lose more weight, but it does sometimes increase those risks of malabsorption or malnutrition. And so with a duodenal switch, even though we keep all of our weight loss patients on specific vitamin regimens, the types of vitamins you have to take after a duodenal switch are actually significantly more than the other procedures. But at the end of the day, this may still be the best surgery for you. Because again, if you're in that category of people that are going to benefit more from it, it's something you want to make sure that your bariatric surgeon is able to offer you. One of the great things about the duodenal switch is it's still done in a way that's minimally invasive. And so because of that, recovery is very similar to gastric bypass as well as a sleeve. Typically, these patients spend one night in the hospital, home the next day. You're usually looking at taking off about a week to 2 weeks for work. The other thing about it is that a lot of the risks that you've heard us discuss with the other procedures are similar. So very low risk profile with this surgery. We do consider things like a leak. Again, that realm of possibility with a leak is less than 1%, somewhere between 0.2 and 0.5% chance of that happening. The other thing we talk about is blood clots that could potentially happen, or sometimes bleeding. But again, even those risks are less than 1% chance of happening. There is a new procedure that we're actually performing as well. It's a modified version of the duodenal switch called the loop DS, or sometimes a single anastomosis duodenal switch. The great thing about this surgery, which we can discuss further in person, is that it provides benefits that we see with the duodenal switch in terms of the excess weight loss and the curative properties for diabetes, high blood pressure, etc. But we're actually able to remove some of those complications we worry about with the traditional duodenal switch. An excellent surgery to consider, definitely something you'll want to make sure we discuss so that we can tailor these needs to your specific needs.